Morning, everyone. Doug Flora here, Executive Director of Oncology Services at St. Elizabeth Healthcare. Glad to be hosting you this month as we take a slight pivot to a new topic. I would remind you, housekeeping-wise, get your brackets in by lunch today. This is March Madness. I've got my basketball bow tie on in honor of my Ohio State Buckeyes, who I'm sure will be out in the first round. As we do this series, we've really tried to touch on cancer fighters of all varieties. We have a different twist today, and that is someone who's dedicating her life to advocating for the fight against cancer. And as you guys all know, cancer fighters are coming in all different shapes and sizes, whether they be providers or nurses or advocates or lobbyists, legislators, and the like. So today we have one of the lobbyist types. We have Stephanie Krenrich, who is the Director of Federal Relations at the ACS. In this role, she's working at federal legislation levels, working on regulatory stuff, other initiatives to promote access to preventative services, quality, affordable healthcare, and all these things that we all care about as advocates. And then she's going to help us walk through how we influence the care of cancer patients, maybe further away from the office, which I can tell you in part 2 of my life has been a very significant revelation. I spent the first half of my career as a medical oncologist giving chemotherapy to fight cancer maybe 16 or 18 times a day to very worthy patients. And I guess as I've approached 50 now, I've been reflecting on how can we scale that, because it's just not enough to treat the patients with advanced cancers and try and give them a better quality of life when we know with legislation and improved access to care and attention to disparities in care, we might actually save those people from needing an oncologist in the first place. So that's where Stephanie comes in, and we're glad to have her. Welcome, and I'm excited for our conversation. Let's start with one that maybe you wouldn't have put at the top of the list, but I'm fascinated by. How do you find yourself in this position of lobbying at the federal level when you seem so nice and normal?
Thank you, I think. So I after college, I wasn't quite sure what I wanted to do, and I thought I wanted to go to law school, and I ended up as an AmeriCorps volunteer, a VISTA volunteer in Helena, Montana for a year at Montana Legal Services Association. It was an amazing job. I got to do community education. So it was kind of an organizing job a little bit, but I kind of traveled all over the state of Montana, which was amazing and beautiful, to help educate folks about their legal rights and responsibilities. Long story short, I kind of got the organizing bug a little bit and ended up not going to law school, much to my parents' disappointment. And I ended up working on a political campaign. And from there, I ended up working for the member that I'd worked for. I worked on a campaign in Illinois, and I ended up working in that member of Congress's Washington, D.C. office after that. And that makes it sound like that's something that I kind of set out to do, but it really wasn't. I didn't know what people did in Washington, D.C. on Capitol Hill. And I sort of fell sideways into it, but it ended up being great because I loved my job. So that's kind of how I ended up here. Is I worked on Capitol Hill for about 8 years. And then after that, I moved over to the Cystic Fibrosis Foundation, where I worked for 8 years. As a lobbyist and doing government relations for them. And then I came over to the American Cancer Society Cancer Action Network. So it was kind of a long journey, but well worth it.
Yeah, you were muted that whole time. No, I'm just kidding. I'm just kidding. We like to make fun of our guests on here, but we'd never do such a thing. Yeah, I love that. And we mentioned we do a pre-interview where I get to know our guests and we sort of walk through how the program will go. And I mentioned to her that my son, my senior in high school, is probably headed down a similar path. He definitely wants to save the world, but he's the one non-medical Flora, has no interest in this world and is studying public policy and public affairs next year. So I love what you do, and I've been learning a lot about it on my own side. Maybe that's a good segue to one of the questions, which is how would someone find themselves in such a role? What does a young advocate do to gain influence, to make a bigger difference, and to lead this life of impact where you can now at a federal level, when obviously you had to climb the food chain a little bit?
I did. So I will say too, there's kind of two different ways to do this. There's sort of the way that you're doing it, Dr. Flora, as you have, your medical career, and then this is something you do kind of as a volunteer. And I just really want to say upfront how critically important volunteers are to this entire process, because lobbyists are a dime a dozen, and there's a lot of us, and we go to members of Congress's members of Congress's offices and their staff, and we kind of give information about policies we'd like to see changed. But the thing that is the most memorable is people telling their personal stories. And I think that physicians, all healthcare providers, patients, patient members' families, going in and really putting a face on the world that folks who have a chronic disease live with, and kind of the things that impact their lives and the things that are important to them is critically important. So medical professionals can go in and say, I live this life every day, and here's what's important to me and what I'd like you to change. And it's so critically important. So I would recommend, and for those on the call who are not already involved in something like this, it's incredibly rewarding. And I would encourage you to talk to Christy Young at ACS CAN, because she's wonderful, and we have a great volunteer program. If you want to do this for a living, like your son, I would say too, internships are a great way to get a foot in the door. Internships on Capitol Hill, internships at organizations, nonprofit organizations, government organizations, Department of Health and Human Services, that kind of thing. It's a great way to kind of see if this is really something that you want to do. I had a couple of internships when I was in college, and it really helped me. So I didn't intern on Capitol Hill. I was one of the few people who ended up in this job who didn't, but that's a great way to do it. So, and also studying government and politics in college is great. You don't necessarily need a master's degree to do this or a JD, but a lot of folks do. So anyway, so that's kind of what I would say.
That's great. And I see a lot of the folks on the call I know well, and the folks in our building certainly understand that we're all cancer fighters. We got about 350 of us in the building. And, I see people here who work for our quality division that are advocating daily for better care, higher reliability, higher reproducible results. We've got marketing people on here, and I see a bunch of advocates from a sales rep standpoint and people who are on the marketing side. Those folks are driving behaviors, they're driving decision-making that will affect people's ability to get screened, to pursue appropriate prevention, even just education. So I think that this group, this ACS CAN vehicle that we use through Coffee Club, really reaches a lot of different avenues. And so I think you added a completely different perspective than we've had before. So people know how many other people are trying to fight for these rights to do things like lung cancer screening or colon cancer screening at 45, or in Kentucky, legislators passed a bill allowing early genetic screening, and that insurance companies were mandated to pay for it. And that's one of the first in the country. So those are the results of relationships that people like you form, and getting the appropriate information in front of the people who can influence decision-making. So it can't be underestimated how much impact we can have if each of us advocates in our own world. So maybe give us a picture, if you will, about a day in the life. Obviously Zoom and Teams and things have interrupted in this pre-COVID era, but how would you have normally spent your day 15 months ago in your current role?
I have to say it's different, but the same. So 15 months ago, my day was usually filled with both internal and external meetings, right? So we do a lot of strategy internally. So we will have meetings cross teams. So the American Cancer Society Cancer Action Network, backing up a little, is the nonpartisan nonprofit advocacy affiliate of the American Cancer Society. So we're kind of our own thing off to the side, and all we do is advocacy. So it's pretty cool, actually. And we have folks who do state relations, Christy included. And then we have my team that does federal relations. So kind of we look at both sort of types of government there. My team also works with the president. Okay, I shouldn't say that. My team works with the administration and administrative agencies. Well, I'd love to have a personal relationship with the president. That's not yet the case. But we do a lot of that work, and we have a policy team and media advocacy. So we do a lot of strategy in-house where we kind of think through what our goals are and how we can best achieve them, what relationships we need to build, what materials we need to develop, we're very data driven. So we gather the evidence, we gather the data, we develop materials so that we have the best case that we can possibly make. So we do a lot of that. I would be remiss if I didn't also mention that we do work with judicial advocacy. So we do file briefs at the Supreme Court. We file briefs in federal courts and state courts on a lot of different issues. So that's kind of the internal side of it. And then externally, I usually spent a lot of my days on Capitol Hill going to different offices and speaking with folks, with staff and members about the issues that are important to us. So I do a lot of work on the Affordable Care Act, Medicaid, Medicare, telehealth, palliative care, and we have specific policy goals within those issues. And so we'll go to members' offices and talk to them about introducing legislation or revising legislation to make it better for people with cancer and their families and survivors. Our main goal is making sure that legislation and regulation really reflects the needs of people with cancer and their families. And, we have seen over and over again, evidence continues to show that access to comprehensive, affordable health insurance coverage means access to good care. It means earlier screening, earlier diagnosis, it means better outcomes. So, that's something I really focus on, and it's a message that we bring to the courts. It's a message we bring to the Hill and the administration. So I go to a lot of meetings. I go to a lot of events. I speak on panels. I'm a lobbyist, so our reputation for having lots of receptions is well-deserved. We do mingle a lot. I'm a good lobbyist. I'm not I'm a nonprofit lobbyist, so I'm not really, the other kind, but so, that's a big part of it too, is just developing those relationships so that when issues come up on Capitol Hill with policy, they'll pick up the phone and call us and ask us what we think. And really, I think that the team at ACS I'm lucky to work with some really incredible people who are just professionals and great at their jobs. So we've got a pretty strong team over there. So it's been pretty fun.
Sure sounds like it. I know quite a bit about lobbying. I've watched The West Wing 3 times. I am a government expert.
Yes.
I'm really excited about the Biden administration. From a cancer fighter perspective, independent of politics, this is an interesting dynamic as this new administration and new Congress has come in. Obviously, there's been a very big push from Joe Biden as a vice president for the cancer moonshot. We were in discussions with the Biden Foundation here at St. Elizabeth even before he elected to run, and they were doing some fairly aggressive measures and really supporting some of these things. And I had spoken a few times to the chief scientific officer for that and was trying to get him to come visit our new cancer center. And then he elected to run for president. So obviously his priorities are right. So how does your life change as different administrations come in and come out? Because you guys are consistent, you're constants, and this administration certainly is suggestive of being much more receptive to cancer issues. It's obviously a hot button issue for the president himself, but also the Democratic Congress and such will probably change your access and a little bit of your goals this year. You might be more aggressive.
Yeah, so I will say up front, we're nonpartisan. We have really great relationships with folks on both sides of the aisle. The change in administration and the change in Congresses always brings new challenges and new opportunities every time. I will say it varies by issue. So we have something like cancer research. We have a cancer research champion as president right now. So that is critical. So, we are meeting with the new administration. We are, really weighing in heavily on sort of their plans for a cancer push everyone was focused on this COVID relief package that we just passed and was just signed into law, which is critically important, and we worked very hard on it. But now that massive package has been signed into law, it's freeing up Congress and the administration to really focus on other priorities. And for the Biden administration, we know that cancer is one of them. So we're thrilled about that. So we think that, we've been really weighing in a lot on cancer research, on a lot of the work that they're doing. And I know that the president seems to really want to be bipartisan about that, which is great. And I think cancer research itself, NIH, NCI, CDC, they've been a very kind of both sides of the aisle are big fans, right? And that's really great. So that's really good. And I think that at the beginning of every Congress, you know, we work hard to introduce ourselves to new members of Congress to make sure they know us, we get in early. For a new administration, we make sure that we're getting in early and introducing ourselves and making sure they know who we are. We're fortunate that a lot of the folks that we have become close to over the years and have great working relationships with on Capitol Hill, a lot of them are moving over to the administration. So we have great relationships over there, and that's all of this is good. When you look at an issue like the Affordable Care Act, which ACS has been really involved in defending over the years, that becomes a lot more partisan. So the dynamics right now in Washington are just a lot more favorable to expanding access to coverage and expanding access to affordable coverage. And kind of like I said before, it's such an important issue. So we were thrilled when this COVID package included expanded subsidies for coverage and a lot of different ways to help people afford health insurance. And that's something that wasn't going to happen under the previous administration or different, you know, congressional majorities. So in that way, that's a very hopeful sign for being able to help people close some of the coverage gaps we have. There's still in this country, there's so many people who don't have health insurance just because they don't have access to it in an affordable way. And we can really change that. So that's something that we work really hard on. Yeah.
Okay, yeah, great. And thanks for that clarification. I certainly don't want to give the suggestion. I meant that as a partisan question. I mean, this particular president's family has been deeply affected and wounded by cancer.
Yes.
And it was his personal pet project, whether he'd be a Republican or Democrat, that cancer was a big issue, which I think all of us on this call probably can agree is a bipartisan interest, especially cancer research. Who doesn't support that?
And I feel like I should say too that it is almost ingrained in myself to do the bipartisan speech, because I feel like we always, you know, anyway. So that's one of the reasons I said it. So
yeah, well, it's no worries. As a physician, we are generally politically agnostic in the room. So I'm interested in any politician that supports people who are fighting cancer. So that was sort of where I went with that question. I didn't mean to put you into a corner there. And I'm sure you've watched your episodes of The West Wing, so you know. Anyway, as we move through to other questions, let's talk about maybe a little bit about what you're most proud of having accomplished. So the folks on the call can understand some of the wins and some of the things that advocating for cancer legislation and cancer funding can actually do that impacts the boots on the ground, impacts the patients and their daily lives.
Absolutely. So we've had some really great wins in the last few years, and one of them is there's legislation that I'm sure maybe some of the folks on the call would know about, where folks who are covered by Medicare would go in for a screening colonoscopy. And if polyps were found and removed during that procedure, they would have to pay coinsurance. Now, out-of-pocket cost. For any other screening colonoscopy, you wouldn't see that. So it was kind of a glitch in the law that was never fixed with the Affordable Care Act, but it should have been. So this is kind of a 10-year-old issue that we've been working on, where some seniors were just getting these very large hundreds of dollars bill for going in for a screening colonoscopy. And it's really in our interest, I'm sure, and in the medical community and in our interest as advocates, to make sure that as many people as can go in and get their recommended screenings regularly. So we finally, at the end of last year, had legislation signed into law that will phase out that out-of-pocket cost for seniors over time. So it's something we worked really hard on. It feels a little wonky, but really it's an out-of-pocket cost for folks for cancer screening, and we want to make sure that we remove every barrier we can to cancer screening. So that happened last year. As well, I think that we are thrilled that the Affordable Care Act is still there and helping folks get health insurance. There are so many parts of the Affordable Care Act that people don't even realize are part of it. I mean, Medicaid expansion and protections for people with pre-existing conditions, closing the donut hole in Medicare, which, you know, had tremendous kind of financial implications for seniors. There's a million things in there that are so important, and we were really afraid it was going to get repealed. So we're thrilled that happened. I will say too that this week, new legislation was introduced to help facilitate Medicare coverage of kind of future technologies for cancer screening. So are these cool new blood tests that would be a multi-cancer screening. It would allow for folks to screen for things all throughout the body. But right now, Medicare doesn't really have a mechanism for considering this type of screening test. So we are actively supporting legislation to help Medicare have a way to figure out if they're going to cover those tests once they get approved by the FDA. So that's a very cool thing that we are working on now. And I'd be remiss as well if I didn't talk about, there was legislation that was signed into law last year as well about clinical trials and ensuring diversity in clinical trials. And it was named after Henrietta Lacks, who is the woman from Baltimore. There was a very famous book about her where her cells have been used for decades for medical research and creating the polio vaccine. And her family was really involved with us in, us kind of working with Congress. This legislation was named after her. And it's really to help kind of gather data and ensure that clinical trials reach more people and more people have access to them from diverse backgrounds and different racial backgrounds and different geographic backgrounds and all of that stuff. So we want to ensure greater equity in who has access to that. And that was signed into law last year. Last year was a great year at the end of the year. So yeah, so it was very exciting. We've had a lot of really great wins.
We've been following a lot of these with interest. I'm glad as you touch on your impact on screening. I'm not just specifically the circulating tumor DNA, but I think those of us in healthcare that are about to feel the brunt of this summer, it's daunting. So, there was a 37% reduction in the amount of cancers diagnosed during COVID nationally, and about 22 million delayed screening tests. And so we anticipate, and we've talked to our directors and our folks in the building about what we're calling a shadow curve of patients that we know are out there, we know have not been diagnosed yet, and are desperately in need of screening. So for the advocates on this line, use every avenue that you can to try and influence people to resume screening in a safe and appropriate fashion. We're open and ready to do this, and I'm expecting that we're going to have a gigantic surge this summer. We're down about 400 cases here at St. Elizabeth that we know are still out there that haven't left our system. They've just being diagnosed with a stage 2B instead of a 3A. So to speak a little bit to the technology that Stephanie's talking about, these circulating tumor cell DNA, they're small fragments that float around in the peripheral blood. And there are technologies now that can adequately detect those well before you would identify things on a CT scan. So we're all about colonoscopies for adenomas and colon polyps, and lung cancer screening scans looking for small increasing nodules to find when they're resectable. The next generation of cancer screening is likely to be bloodborne. And currently insurance companies are not incented to provide coverage for those. That's a big one. And some of those tests have been validated so far in the cancers that we just can't screen, like ovarian or pancreas. So there's a gigantic interest on the clinical side to do the good quality research with scientific rigor to see if we can affect survival with those. Part of that is also being able to do the test. And right now the cost is prohibitive for most patients. So what about future looks? What are you most excited about for the next year? Things that you're gearing up for, things that'll be a big part of ACS and ACS CAN's national push from your perspective.
So just to piggyback a little bit on the multi-cancer screening that you just talked about, if folks are interested, we hosted a webinar last week and had some incredible speakers come in and talk about this and why the legislation was necessary. And Dr. Bert Vogelstein from Johns Hopkins spoke. Anyway, it was incredible. So I'm happy to pass along that link if anyone's interested. In addition, for this year, I think we are interested in pushing additional funding for cancer screening. And to help folks get back to screening, like you were saying, I think a lot of physicians are concerned. I mean, we're all concerned about the lag in screening. So making sure that folks can get screened is something that we're going to be working really hard on this year. Cancer research, incredibly important. We're thrilled to be working with President Biden on all of the work that he's pulling together on cancer. So that's going to be really important. Health equity is a really important issue right now for ACS, ACS CAN, and really I think across the country, there's been a really important renewed focus on ensuring greater equity in terms of who has access to insurance coverage and screening and care. So that's something we're really going to be working hard on this year, and we're sort of doubling down on our efforts. In addition, we're working to ensure that access to care is something that is continued to be focused on. There were some great temporary measures taken in the COVID package on health insurance coverage to help make it more affordable. We'd love to see those made permanent. We are also continuing to push our legislation on palliative care. It's the Palliative Care Education and Training, Palliative Care and Hospice Education and Training Act. And it's a workforce bill to help kind of really bolster the palliative care workforce, do more research on palliative care to kind of really quantify its benefits. So that's something else that we're working on. We also are very excited about all of the ways that telehealth has been utilized more and more lately. So that's something that we're following closely. And we really want to make sure that we're focused on, and also, of course, tobacco cessation, tobacco control. That is a big contributor to cancer, and we would like to help folks quit if we can, and help in, and help, encourage legislatures, states and federal legislatures to really take that seriously. So those are all important.
Sounds worthy. Yeah, one of the reasons that I joined the American Cancer Society Regional Board this year was I really felt like this was the group that was most passionate right now at a national level working on these equity of care issues, and disparities of care are, for those of you that don't know this, this should be one of our most energetic efforts. We're seeing great inroads in terms of the way patients with cancers live. The length that they live, the ability to be screened, the ability to be found with early detection. We're approaching 17 million survivors. Unfortunately, persons of color, persons who are not primary English speaking, persons who are socioeconomically disadvantaged still are, their survivals are probably where we were in the mid 90s. And those populations are not enjoying the protections and enjoying the access to care that the rest of the American society is, and that's sort of falling short of who we'd like to be as a country. So I know that the American Society of Clinical Oncology president has made that her primary initiative this year. I know it's one of the ones that we are talking an awful lot about in our own hospital and our own healthcare system here. So I liked what ACS is doing to purposefully address disparities of care, using the gigantic podium that you guys have and the great funding and resources and folks like yourself. So I'm excited for that because it's probably about 10 years overdue, and those numbers are stark. We talked last month or maybe 2 months ago about the inability to screen patients for colon cancer at a cutoff of poverty levels, and that if you make more than $75,000 a year, you're exceedingly likely to get screened, upwards of 83, 84%. Whereas people who fall below that $75,000 per year line, which is a fairly well-off American family, the numbers drop into the 30s or 40s as you get into those lower percentages of incomes. And when you reach the poverty level, screening is almost it's almost not done. People can't afford to take off work. People are paid by the hour, don't have the benefits they need, or don't have access to insurance at all. So that's where people like Stephanie come in to make sure that those folks don't slip through the cracks. What about your own role at ACS CAN, linking together all of these state initiatives? I work with Krista Young and the Kentucky and West Virginia and a little bit on the Ohio side group and Eastern Indiana. How do you guys coordinate your issues in policy, and how do you make sure that the things that are being done at the state level are amplified at the federal level?
That is a great question. And one of the things that I was so impressed with when I first started working at ACS CAN, I've only been here for a couple of years, is how well coordinated it is. And I think that we are really lucky to have like some smart strategic folks at the top, to make sure that kind of as we do a lot of kind of cross teams meetings. So when you talk about something like health equity, or you talk about something like screening, folks like Christy and other folks, kind of, we all get in the room together. I guess the room is virtual these days, but we all make sure we're getting in the room together. And, so for Access, I'll say, I'm working on this legislation right now having to do with some of these non-compliant healthcare plans that aren't real insurance, that don't help people with pre-existing conditions at the federal level. right? So this is something that we're concerned about. You know, there are regulations federally on this and legislation. And then I'll talk to my counterparts at the state level, and they'll say, well, in these 5 states, they're pushing these bills. And we just make sure that we all kind of get together and talk to one another so that our goals and the things we're achieving, our strategy, so that everything sort of matches. And I'm very lucky to work with some really great professionals we all communicate with one another. And we're really able to kind of execute simultaneously on both the federal and state level on a lot of these issues. And actually the colorectal cancer screening that you've been talking about is another great example of that, right? So making sure that insurance covers colorectal cancer screening at age 45, making sure that, I know we're working on the follow-up colonoscopy issue, where if you get a positive FIT test, stool test, that then you don't have to pay for the colonoscopy out of pocket afterwards, that it's counted as a screening colonoscopy. That's an issue we're working on at both the federal and state level. And a lot of those issues, we really try hard to make sure that everybody's coordinating with one another, so that we can kind of all sing from the same hymnal, as it were. So yeah, I think it works pretty well. And actually, there's another thing that I do want to make sure I mention about coalition work, because I've talked a lot about the American Cancer Society, Cancer Action Network, and the work that we do. But we also partner with some really incredible organizations across the cancer spectrum, including ASCO, who you mentioned before. We love them. And then other patient advocacy organizations. And, we work with the Heart Association and the Lung Association and the Diabetes Association. And we all make sure that we're all working together as well, to really make sure that the focus is on what patients need across the spectrum. So the coalition we do as well is really a critical component of this too.
Yep. How about for the folks on the call, and these will be recorded and shared, how would you recommend they get involved supporting the efforts of ACS CAN?
Oh, well, definitely get involved. Please get in touch with us. Christy Young is your best contact for that. She really coordinates a lot of the volunteer work in your area, and she's wonderful. So she is off camera right now, but we will make sure that if you're interested, we'll make sure to connect you with her. Christy just gave you her email address in the chat, and she's great. So please get in touch with her, and she can loop you into things that are happening in your area. She can loop you into things that are happening federally. We'd love for you to get involved. So welcome.
Yeah, it's been rewarding to get involved with groups like this and be involved in the Day on the Hill, where we spent 8 hours with our legislators one-on-one with many of them. My own personal congressperson and I had an hour-long conversation together about these issues. And it was really instructive for me to find out the perspectives that he had as a representative in my own district, but then also to show him why that maybe wasn't exactly what happened for boots on the ground. And I think he found it informative. And we worked through, I think we had access to 3 or 4 senators in one day, at least their senior legislative staffers, one senator, and then a number of the Congress people. So it was really interesting to actually speak with representation face to face for the first time. And I'll be looking forward to doing that in future years as well. Maybe as we close, we're running short on time here. And I saw that Christy did share her email address and fightcancer.org. I'll make sure I put her personal cell phone on here for all of you as well. She's going to have lots of energy to return text today. She's recovering from her Moderna vaccine and is flushed with fever right now. So for you guys who come in each month, and obviously a lot of you are regulars, and as we vary the topics, I think we're going to be touching base with patients in coming months to hear maybe a little bit from the patient perspective, probably some researchers, and talking about the research bent that we've been discussing. Maybe the take-home point as we leave Stephanie today is how many of us are working to do this and how important it is to build these coalitions and these bridges. So I know that my own staff, we're trying to get on regional boards and local boards that affect change at the local level. And as our own enterprise grows, we're starting to see greater levels of influence for each of these people as they get in rooms that they wouldn't have previously been placed in. When you have lobbyists like Christy and Stephanie, you're starting to see how you can scale even your own perspectives. So if you have issues that are important to you, you reach out to these guys and they can take up the front and start to build some bridges with relationships with people that you might not otherwise have access to. And I've seen it in the Kentucky state legislature. The relationships are pretty strong. And it's a lot of people that you might have perceived as unreachable or untouchable because they're elected officials, when in fact they're desperate for human contact and they really want to understand some of the issues that affect your daily lives. So I guess as we approach future months of this thing, we'll start to fill in the other parts of the puzzle that would take. But you're seeing how people like Christy and Stephanie are starting to make things that affect your daily lives. If you're someone who promotes screening activities or someone who's responsible for the quality side, to make sure that we have processes built that protect people who've had positive Cologuards but never had their colonoscopy. So if you're a quality officer and you're building the policies and procedures and the PDSA that will affect those patients, Stephanie and Chris, you're people who get those tests paid for. So it is a team event. So Stephanie, thank you for being with us today. And I appreciate those of you that joined us. I know sometimes when you start to hear about lobbying and legislative efforts, maybe we're keyed up about it because this is a lot of what we do. Hopefully you have a better picture of what folks like this do in their daily lives and how it affects cancer patients just as much as those of us that are seeing patients in the room and can establish contacts. The contacts for these guys will be in our chat if you guys wish to reach out and establish your own bridges at the state or federal level. I'm sure they'd like to help. Stephanie, I'll be sending my son your way so he can watch you and learn from you as he tries to save the world in his own little fashion. So thanks for joining us. We'll be back in a month or so, and we'll have teasers coming out about our next topic, to be determined as of this point, but we're glad to have your support. And any questions or support or concerns or things, you've got Christy's contact, and she's responsible for all the hard stuff. I get to do the fun stuff. So take care and be well. Have a good day, everyone.
Thanks.